Hello, my name is Sebastian Schostek. I'm Head of Research and Development of Diagnostic Systems at Ovesco Endoscopy. It is my pleasure to have a few minutes on this platform together with Professor Alexander Meining from University Hospital Würzburg, Germany, to present and discuss a novel tool for gastrointestinal diagnosis, the HemoPill acute. The HemoPill acute is a non-imaging swallowable capsule for the real-time detection of gastrointestinal bleeding. The intended use covers the upper GI tract and the small bowel. The HemoPill acute is less than half the size of a common video capsule, but instead of a camera, it contains a photometric optical sensor that is highly sensitive to the presence of blood. This means that it reliably detects blood when diluted in other media, even if it is not visible to the human eye or a camera. With this feature, the diagnosis works even if the GI tract is not empty, therefore, patient preparation is not required for application. The application of the HemoPill acute capsule is straightforward. After activation, the capsule is swallowed by the patient with a glass of water. It transmits one sensor reading every 4 seconds for the total duration of 9 hours to the HemoPill receiver. The data is presented graphically on a single screen and is updated in real time. The sensor value is given as HemoPill indicator or HI value. Interpretation is as simple as that. A HI value of below 1 is interpreted as no blood detected, while a HI value of 1 or higher indicates the presence of blood. This threshold is reduced to 0.8 for the first 10 minutes. The very first clinical use of the HemoPill acute after market approval was conducted under the supervision of Professor Meining in 2019. He also heads the first investigator-initiated multi-center clinical trial on the HemoPill acute. Professor Meining, what is your main use scenario in future clinical routine and what are your expectations?
Yeah, thank you very much. I'm very happy to answer this question. I was also very proud for me and my team to be the first at using the HemoPill, and so far we have quite good experience from some cases. However, as you mentioned before, we are also conducting at the moment a prospective multi-center study evaluating its further use. So what would be the main indication in my opinion? I think you have to regard it as somehow as a sort of a troponin test for the GI patient. So if a patient is submitted to the emergency room with a suspicion of an GI bleeding, upper GI bleeding, and the patient has no hematemesis, the question is always, when should I do an endoscope in this patient? And if you look at the ESG guidelines, they recommend to do it within 24 hours. So what would you do if the patient is some sort of not really critically ill, is stable with respect to blood pressure and heart rate? So would you always have to do an endoscopy at Saturday, at Sunday, or maybe even at night? And so we use these HemoPill capsule really to have a very quick answer on whether we should do a rather emergent endoscopy or whether we can wait maybe up to 2 or 3 days or maybe even longer, or send the patient at home, reconfirming him that this is no severe bleeding. We have to do something, but we don't have to do it right now. So I would see the HemoPill as a very fast and acute and accurate test to tell you that you have to do an emergent endoscopy or not. And the patient doesn't have to be starving. So you can do it even in a patient that had his or her dinner before, and then you see right away that the patient needs to be kept in the ward, and an endoscopy has to be done rather soon, at least at the next day. Or you can say the patient, don't worry, we will take care of that, but not now, not at the weekend. We will wait until Monday or Tuesday, maybe.
Professor Meining, thank you very much for these insights, and I wish you and your colleagues all the best in these challenging times.
Thank you very much. Thank you.